So I'm happy to be co-presenting with Professor Pamela Qualter, who you'll hear from shortly. She's a paragon of research into loneliness. And Dr. Nina Goldman from the University of Basel, who's our collaborator and will be doing some exciting work. And as you know, this talk is really about celebrating Mental Health Awareness Week. And this year's theme is loneliness, very opportune for us to be here and to be able to engage with you. So like I said, my name is Austen. I'm director of the Self-Care Academic Research Unit at Imperial College London. The department is a WHO collaborating center for public health education and training. I'm a mixed methods researcher and an NHS manager within Imperial. And we have a very close working relationship with local authorities and a wide mix of stakeholders. And we're doing a lot of work on issues that span health and social care. The department is also host and collaborates with the NIHR Applied Research Collaboration Northwest London, headed by Professor Azim Majid. I'm now happy to introduce Professor Pamela Qualter.
Hi everyone, it's really lovely to be here today. Just to point out, I'm a psychologist. I am a professor of psychology for education at the University of Manchester. And it's a strange thing, a psychologist kind of moving from their primary position within a psychology department to move to education. But you'll hopefully realise throughout my part of the talk why I've made that move. So I've been researching loneliness amongst children and adolescents for about the last 30 years or so. I've run big longitudinal studies. I've done randomized control trials. I've used experimental and EEG methodologies. And more recently, I've moved to look at using more qualitative methods. So a whole range, really, very pragmatic, using the right kind of tools to get to answer the questions that I have. I ran the BBC Loneliness Experiment, which some of you will have heard of. The biggest survey of loneliness in the world. Over 55,000 people across the world gave us information about their experiences of loneliness, but also provided really nice data that we've been able to analyse to address issues to do with stigma of loneliness, how emotional knowledge fits with loneliness, and so on. We also produced a Radio 4 programme which was headlined by Claudia Hammond. And in that, we talked about youth loneliness, but also how loneliness changed across the lifespan. And we've got some nice podcasts as part of that talk about ways to manage loneliness. More recently, I've moved on to do a lot of work with England's DCMS, Tackling Loneliness team. And recently, we've published an evidence gap review that I led on with a large number of academics, where we highlight those key gaps in our knowledge about loneliness. So I'll hand over now to Nina.
Thanks, Pamela. I'm Nina. I'm new to the loneliness research field. I also come from a very different background. So my background is in human geography, where I studied influenza and influenza vaccination behavior on a city level, so doing spatial and quantitative analysis. Last year, I started working in Munich, at least on paper, in the Institute for History and Ethics of Medicine. And there I do qualitative work on ethical implications of social media recruitment, especially for clinical trials. I'm also currently a lecturer at the Department of Environmental Sciences at the University of Basel, where I also did my PhD. And there I basically teach courses on urban health, empirical social research, and take students on various excursions. So my new project at the moment is Geographies of Loneliness. At the moment, it's sort of a side hustle, hoping that it will be my main focus of research beginning in autumn or next year, where I want to compare loneliness between and within cities. So let's focus on Basel and Manchester, but probably also including London, since this is the place where the Interact study started. And with that, I'll hand over back to Austen for the talk.
So really the presentation is going to be in three parts. The first part will be talking about loneliness, trying to understand it. What is it? And we're going to ask the question, is it going to be the pain of living in the 21st century? We know that loneliness may be on the increase, and we're hearing a lot about Society 5.0, which I'll talk about. We're also going to look at the public health impact of loneliness, pre-COVID and since COVID. and how governments are responding, not just the UK. We'll then pass on to Professor Pamela Qualter, who will tell us about risk factors, talk about loneliness in children and young people, some of the interventions to tackle this rising problem in society. And this would then lead us naturally to our last segment, which is going to talk about the Interact study. It's a new study we developed to create a heat map of loneliness. And we'll hear back from Nina, who's going to tell us about the UK-Switzerland collaboration, and then we'll have some time for Q&A at the end. So what is society 5.0? Now we are 4.0, which is characterized by the fourth industrial revolution. So here we have digital, we've got lots of machines, we're very connected, and we have startling efficiencies in supply chain. The idea of society 5.0 is really where artificial intelligence comes into play in a big way to expand human capabilities and to help us address social challenges. So AI will transform big data that we already have and how it's collected and how it's used from the Internet of Things into a new system and to redistribute wealth and therefore tackle inequalities. Now, this is the vision and the fantasy, of course. We hope that comes to light. It will be defined by the pervasive use of AI, cyber physical systems, nanotechnology, robots, blockchain, drones, and 3D printing as primary drivers. And already we're seeing a lot of talk about the metaverse. Now, we know that when loneliness becomes prolonged, it can become a problem and it can inhibit social connections and cause harm. And in this way, it's one of the factors of the social determinants of health. And there is obviously a psychosocial dimension to loneliness, and this can influence personal behaviors, our lifestyles, and our ability to self-care to maintain a good quality of life. Loneliness is an emotional perception that can be experienced by individuals regardless of their breadth of their social network. So therefore, it's a very subjective feeling and often described as unwelcome. This is distinct then from more social isolation, which is a measure of the number of contacts and connections people have. Now, there are patterns of loneliness. People can be lonely, but not socially isolated, this orange here, or they could be socially isolated, but not lonely, or they could be socially isolated and lonely. And this is probably the worst place to be. We've been aware of the public health impact of loneliness for some time because it has both an emotional and a health impact. And it's true that the level of social disconnection we have can actually endanger health. So it is a public health issue, and it does deserve serious attention. So it's great to see that Mental Health Awareness Week this year is focused on loneliness. Obviously, we discussed that it's inversely related to the overall quality of life, and it has psychological effects. It may be associated with lower self-esteem. People may then have limited use of active coping mechanisms. They may become apathetic, not wanting to leave the house and so on. And therefore, their lifestyle will be affected. It makes people less likely to pursue health-seeking behaviors, less likely to go out to the park, see friends, or and that's vigor, right? So exercise and so on. The policymakers have known this for a while, and they class loneliness as one of society's wicked problems. And what they mean by that is this is a problem that you can't just throw money at. So this is something that has to be looked at from many angles. The UK government responded in 2018 because it did recognize that this is one of the greatest public health challenges of our time. And at the time, Prime Minister Theresa May confirmed that all GPs in England will be able to refer patients experiencing loneliness to community activities and voluntary services by next year. And since COVID, the government has published fantastic resources. The United Nations and the WHO have also recognized that loneliness is a priority health problem. So the WHO is very keen for governments to work harder to tackle this rising problem. An interesting insight here, I think for some people, that the point of playing online games is often not to win, but to connect and feel a sense of being a part of a virtual community. The big question is this going to help us connect more with people and have quality relationships, or is that going to be a driver for loneliness? We don't know. It will be very interesting to wait and find out. But to learn more about the risks and more about loneliness, I'm going to pass this now to Professor Pamela Qualter.
Okay, thank you very much, Austen. So I'm going to take us on a whistle-stop tour then of the implications of loneliness and get us to think about the interventions that might be available. Across the lifespan, we see that loneliness does seem to have emotional and health impacts. The key, though, is to think about, it's about prolonged loneliness and not getting stuck in loneliness. Feeling lonely sometimes is actually quite effective and useful for us. It enables us to re-engage, work out what we want from social relationships. And it might be that we want more social interaction, so we just need to be with people, or it might be that we actually need, sorry, it's okay, yeah, sorry, don't move on yet, Austen. But it might also be that we want to change our quality, the quality of our close relationships. Now, either of those is problematic when it's experienced in a prolonged form, when it becomes chronic. And what we see is that people who experience that over several months or years, we see that it has these kind of impacts. And this is across the lifespan. So for children as young as 7, we've shown in studies that it impacts their sleep. We find the same thing with loneliness during adulthood. Also, it impacts activity. So as Austen said, your choice to go around the park, your choice to go to the gym, it's all impacted by your feelings of social connection. Across the lifespan again, and this works with adolescents and adults, we see this reciprocal relationship between mental health and loneliness. So we see that those with poorer mental health also report loneliness over time, or increases in loneliness over time. People who are lonely also start to report, if they experience loneliness over time, they start to report higher levels of depression and higher levels of anxiety, particularly social anxiety. So there's this reciprocal relationship between those. The one you've heard a lot about is the fact that loneliness seems to impact our cardiovascular system. Now, of course, we don't see that kind of effect amongst children and adolescents, but with prolonged loneliness, what we see is that wear and tear effect of loneliness. It wears down our cardiovascular system. So what we see is amongst older people, we start to see the impact. So we start to see coronary heart disease, we start to see stroke, and we start to see increases in premature mortality. What's interesting is recent work from Denmark shows that social isolation predicts all of these things. But if you are lonely and you're socially isolated, you've got significantly more risk. The risk of cognitive decline is interesting. This also seems to be impacted by socioeconomic status as well. But once we've controlled for that, we still seem to have an impact of loneliness. And again, that's across the lifespan. So even amongst children, we're seeing that they are performing academically less than we would expect from them if they're reporting loneliness. We also see a real risk for self-harm and suicide. Now, that work has only looked at adolescents and old age, but we certainly see that for both groups of individuals. And that's a prospective relationship. That's a relationship that we see over time. So really what we're saying is that there are health impacts of experiencing loneliness. And that's why it's a public health issue. So you can move on to the next slide for me, Austen. Okay, so these are the risk factors. So we kind of now know, because we have more prospective pieces of work, we now know that loneliness is linked over time with these health outcomes. So what kind of predicts loneliness in the first place? Well, there's a whole host of risk factors. And again, some of these we see across the lifespan. So we see for adults that socioeconomic status, for example, is really important. We find the same thing for children and adolescents. And that's probably because if you can't keep up with your peers, whether that's in terms of having access to resources or even having access to, the social resources. So being able to afford coffee in a coffee bar or a McDonald's in a McDonald's bar with your friends. Those things are really important. So having a lower socioeconomic status seems to impact on experiences of loneliness. For For sexual orientation, this is an interesting one to highlight, because what most recent research suggests is it's not actually sexually minority groups that experience loneliness. It's only when you identify as being from a minority group, and then you are in an environment where that is discriminated against. So it's the notion that you are different, but that society doesn't like the fact that you are different. And I think for me, that's really important, because it's not saying that it's about you. Those risk factors are evident, but of course, those risk factors actually take place within societal frameworks and infrastructures. So those external societal things really matter. And that includes the geography, which of course we'll move on to talk about later. Having access to those parks, having access to resources such as GPs and so on, all of those things really matter. So if we could move on to the next one for me, Austen. Okay, so this is primarily where my work is on children and young people. And interestingly, people talk about how loneliness amongst adolescents has increased. And actually what we find is there hasn't been an increase in loneliness actually for about 50 years amongst adolescents. But what we are seeing is, because we're talking about it more, people are opening up about that. So we're getting a real understanding about the prevalence of that experience. Also, even though, again, we talk about loneliness increasing amongst adults, if you look at those who are experiencing chronic levels of loneliness, so prolonged experiences, we tend to find only about 5 to 10%. And again, we've found that for the last 50 years as well. Of course, our population's growing. So it might stay the same percentage, but we've got more people that we need to support. We do see a developmental change over time. So what we see is we see an increase from childhood to adolescence, to the point that we see really at between 16 and 24 kind of loneliness at its highest. And what we see is that 15-year-olds report more loneliness than 13-year-olds, more than 11-year-olds. And if we're allowed to go a little bit lower, we also work with 8-year-olds. And that shows us that the 11-year-olds are even more lonely. So there's this developmental pattern. But as I said earlier, this is about, to some extent, normal experiences of loneliness. All sorts happens during adolescence. That means that your notion of fitting in, your idea of being different, is heightened. We've found more recently, using the PISA data, that school is really important for young people, in the same way, actually, that communities and work is important for adults. And creating that school environment that's trusting and accepting of difference is really important. If we could move on to the next one, Austen. Okay, so this is different pathways of loneliness. So it links to those risk factors that we talked about before. There certainly are things internal of the individual that are important risk factors. So here we've talked about personality, we've talked about the number of social groups that one is a member of, and also psychological response. And that's an interesting one, because what we've found is that there's almost like a genetic predisposition to prolonged loneliness. What we find is that at normal rates of loneliness, our focus on threat is heightened. Some people are programmed to see threat much quicker anyway. So if you have that predisposition and then it's peaked by experiences of loneliness, you can get stuck in that cycle. But of course, by focusing on the individual, we're missing the fact that that individual sits within communities, within countries, within the world. And all those other things have an impact. And like I say, we know that life events, traumas are all triggers for loneliness. And as I say, normal levels of loneliness, but they also can push somebody into chronic levels, and also environmental factors. And that's what's so exciting about this project, is it's going to allow us to look more at some of those environmental factors and do that at a local level where they can have the most influence. So if we can move on, Austen. Okay, so dealing with the stigma, this is really important. There's lots of research, or there was lots of research from the 80s that talked about stigma and said there was stigma in society. And the DCMS Tackling Loneliness team was very focused on trying to change that. And what we found is there doesn't actually now seem to be that much stigma in society about reporting loneliness. But what we do see is still that self-stigma. People are embarrassed still to say to others that they are feeling this way. I mean, I found it astounding that it seems to be the last mental health taboo is actually loneliness. And this highlights for me the fact that we need to not just understand the individual and the impact that the individual has, but also what does loneliness do if you are living with somebody who is reporting loneliness? How does that impact your experiences of stigma? And you can go and have a look at some of that work, which we've highlighted in the DCMS report. If we could go on to the next one, Austen. Okay, so interventions to tackle loneliness. There are loads. There are absolutely loads. And in a recent meta-analysis that I did with several colleagues over in Denmark and in Australia, we basically reviewed the academic literature and the grey literature, looking at those interventions and how effective are they. The thing that is really obvious is there's very little quality evaluation of interventions, very, very little. But the research as a whole is actually suggesting that any kind of intervention seems to be effective. And that's likely because what contributes to loneliness is quite different for different people. So for me, it's about being able to offer individuals an intervention that works for them. And of course, if it's about, if you're feeling lonely because you just want to be with people, joining social groups is going to be potentially quite an effective strategy. If you are feeling lonely because you don't really have the quality relationship with your romantic partner, that's going to require quite a different intervention. Yeah, and somebody who is stuck in loneliness, where we see those threat detectors and those negative cognitions, that's going to need something different again. So there are all sorts of things, and we've listed on the slides, and there's another slide next, Austen, that lists some more. There's all sorts of different things available to people. The one I want to highlight here is the social prescribing, because it is the intervention, the government's focus at the moment for loneliness intervention. It sounds great in the sense that you have an opportunity to speak to somebody about your experiences, and then with them decide what opportunities in the community you take. So again, with that focus on, is it a social integration issue, or is it about a quality relationship issue? And so individuals can provide the right kind of support mechanisms. And what's great, for example, in Manchester, is we have social prescribing from college upwards. Now, whilst there's no evaluation of social prescribing for adolescents, we're beginning to do that. We can have a look to see whether that makes a difference for adolescents who report loneliness. So if we go on to the next one, Austen. I think I might be handing over to Nina. Oh, no, we're measuring. Oh, I've got loads, haven't I? I'll go quicker. You should have told me, Austen. Right, so the importance of measuring loneliness. We've got really good measurements of loneliness, but we need to make sure that those measurements can effectively predict change in the interventions, but also that they, so they can predict change in interventions, but actually they can be used appropriately to predict, to identify individuals reporting loneliness. And that's become really evident, I think, during COVID, because most of us did experience loneliness. For some people for the first time, but actually some people are still stuck in that loneliness, and it's about appropriately identifying them. So if we can move on to the next one for me. Okay, so these are the different measurements that we have available to us. In a recent examination of the UCLA items, we found that the UCL3, which is recommended by the government, is actually a really good measure. The UCL4 is UCLA 4 is better, but the 3 item is still good enough. I think in combination with the direct measure, we've got some really nice measurement tools that actually work across the lifespan. So from, I would say, 11 upwards, we're getting very similar understandings of those different items. What I would say to people who are thinking about evaluation of interventions is not to use both. I know the government says use both on their website. I wouldn't, because what you will find is you will get much more coverage actually with the 3 item. More people will tell you they're lonely because you don't use the term lonely. The direct measure will ask quite explicitly. So you actually have to identify as a lonely person. And what you will find is many people don't, because there is still that stigma attached to it. So if we move on to the next one, the heat maps bit, sorry, just one last thing. So the heat maps that is being conducted in this study, it's not new, it's been done before. The ONS has done that. What's really exciting about it this time is it being at that localized level. You know, the ONS showed that we've got these pockets of high loneliness across the country. And actually where I live in Blackburn is right up there, and I can see why. But what we now need to do is to think, well, within those localities, where is that division? And how does that link to other things within that environment? So I'll hand over to Nina now.
So we have a little anonymous poll if you would like to join. We would like to invite you to take part in it. You can open the chat. There's a link to the poll, or if you have your phone with you, you can also scan the QR code. And it will just take 1 or 2 minutes to fill it out. I'll just keep talking a little bit while you try to fill out if you want the little poll we have, and I'll quickly flash up the results later on in the talk, so we get a sense of who is participating or how lonely we feel at the moment. So nice, the responses are coming in slowly but surely. Yes, so it's basically also to give you a sense of what kind of questions are asked in the UCLA 3 and the direct measure, and just a selection of interventions, so you can pick your top 4 that might work best maybe for you, or that you feel might work best in general. And attaching to the talk, of course, if you feel that we will maybe suffer from loneliness more in the future, or so on.
So thank you, Pamela and Nina. I'm happy now to share our exciting project measuring loneliness in the UK Interact study. So this study has been launched in the community setting, and we're launching it in NHS primary care this week in Mental Health Awareness Week. So the aim of the project is to create a heat map of loneliness to inform place-based interventions at the local level. We are going to do this by working in close partnership with local authorities, community groups, and NHS primary care to engage with a very wide segment of society. Anybody who's 16 years or over practically can choose to participate by completing a very short anonymous tool, which we'll have a look at. The research group is listed here. And of course, we are working in partnership with the NIHR Clinical Research Network, the Applied Research Collaboration for Northwest London, and of course, Imperial College Health Trust. So like we said, heat maps have been done before, but they weren't granular enough. So there is an opportunity to revisit this idea of developing heat maps, this time with support from local authorities, the Directors of Public Health in the local authority, and NHS primary care, the GP practices. And the idea is to invite people to contribute by completing a survey. The 3-item loneliness scale is basically 3 questions, we shall see in a minute. And then the Office for National Statistics direct measure of loneliness is 1 question. Add the full postcode, the respondent's age and gender, that gives us 7 questions. Here's the survey. So here you'll see a tick box consent. There's a link to the participant information sheet. You enter the full postcode. You may complete these questions. So the Interact survey has a number of components. You've seen the first component. We think that will take less than a minute to complete it. and we will map the data to within 100 meters. So there's no issue in terms of privacy or identifying people. But participants can choose to continue the survey to the next stage and complete other questions, looking at social capital and other demographic data, for example, if they're working, employed, if they're cohabiting, if they have any pets and so on. And then they may even continue to leave their name and email address in case they're interested to be interviewed by the study team. So just to exemplify, the idea is to work with the local authority so we could collect data at the local authority level, at city level, and maybe regional and national level. And that data will be very useful for many things. For example, we could target interventions, we can compare the extent that the data tallies with predictors of loneliness. There's so much more that can be done. So we started in Hampshire and Fulham for a number of reasons. One, because we work very closely with the local authority. We know our collaborators very well, and the local director of public health. So it's really a pleasure to be collaborating with them on this. And also Imperial College London has a foothold here. Our department is based here. And the college is also building a very big campus in White City, which is in the north of the borough. So we developed the instrument and we shared it. We had some co-production. And their recommendation was to translate the survey into 11 languages so respondents can complete in the language of their choice. And Harrods and Fulham were very proactive. They also developed a British Sign Language video resource available on their website. And they also launched the study on their website on the 17th of January from the community perspective. So it's our pleasure to be collaborating with them and to look at the data from HNF as a pilot site that hopefully will show us how things will go. So anybody aged 16 or over can participate. We're also recruiting from schools, care homes, and other settings. And we have a favorable ethical opinion. And the study was externally peer reviewed, and it's on the NIHR clinical research portfolio, which is great. The success of this project would depend on collaborative working with a number of partners, including the local authority, directors of public health, and GP practices. So at this stage, I'll hand over to Nina. If you're happy, Nina, to share the poll results with us.
Yes, I'll share the screen. I'll need permission to do that. Okay. Basically see the first 3 questions from the UCLA item. We see that almost half of us, or the people who responded just shortly, feel that they lack companionship some of the time. I'm not sure if this might be a representative sample. Maybe it would be interesting for Pam to comment on that, or not. I'll just show you, I'll just scroll through the answers. So how often do you feel left out? That's quite a big chunk of us. So maybe some of the measures you saw might also be inspiring for some of us. How often do you feel lonely is also distributed evenly. So we have often or always, some of the time, occasionally, and hardly ever. The most favorite interventions seem to be befriending others, for example, also through groups like men's sheds and the like. Awareness campaigns, so talking about it in schools, public spaces, social media, and social prescribing of link workers. And do you feel it might be a problem in the future? So most of you seem to think yes, some seem to think no, and someone's not quite sure. So with that, I'd actually like to hand back.
So we're very happy to hear of your vision for collaboration between the UK and Switzerland.
Yeah, first of all, thanks a lot for the very welcoming collaboration feel. So basically, I just reached out to Austen, I think it was in January because I saw that they launched the Interact study, and as a geographer, obviously, I got very excited about looking at loneliness on a spatial level and trying to figure out what might space how might space impact how we feel. So on to the next slide. So basically, it's sort of building on the work that we've just seen Austen present on the Interact studies. And I'm developing a new project. It still needs to be signed off or approved by the Swiss National Science Foundation. But if that goes through, I could work 2 years full-time on this loneliness project, which I'd be very happy to do, also with 2 wonderful hosts, Pamela and Austen. So the aim of sort of my little section of the project would be to develop a better understanding of how various neighborhood features can help reduce the prevalence of loneliness and social isolation in the community setting. So very much basing the work on the Interact studies and going deeper. So not only figuring out where are we or where might lonely people cluster, but also figuring out, well, why are they there and not anywhere else? Like, are there certain neighborhood features? We can also discuss it later on, if you like, that make people more prone to feel socially isolated. So that could be anything from lack of access to park to no cafes, sort of the social infrastructure, we might also call it, as Christopher Swader put it in his paper. So how am I going to approach this project? So the idea is to have a sequential mixed methods research design to address 4 specific objectives, which are on the next slide. Thank you. So first of all, it's basically just getting an understanding of people who work in local initiatives who help reduce the prevalence of loneliness and social isolation, to get sort of a sense of who are they dealing with, who are the people who actually come and take part in these local initiatives. And maybe that would help us inform how to address the people who are maybe not showing up to these initiatives, but might feel lonely. In a second step is characterizing the prevalence and spatial patterns of loneliness and social isolation in 2 European cities. So I'm proposing to do this for Basel and Manchester, but of course, it would be very interesting to also have the London data, maybe also compare London to Manchester, both UK cities, and then to Basel. That might give some really interesting insights into, what's important on the local level and what might be the difference on an international level, especially as Switzerland is not really in the loneliness game yet. Although on a local level, I have to say in Basel, there are some, stuff is progressing. The local government was asked for a strategy on loneliness by a couple of politicians. So they've got 2 years to basically answer that question. And there have been more news reports on people who feel lonely. So for people who talked about the loneliness experience, and that has sort of blown up and more people have sort of come forward to talk about their own experience. So things are moving, but I say a couple of years behind probably what you've experienced in the UK. So the next 2 objectives are understanding the perceptions of socially isolated and lonely residents. So as for the Interact study, there is the possibility, or there will be the possibility, to leave your contact details if you are willing to be interviewed on your experiences of loneliness. And lastly, sort of trying to bring it all together, trying to figure out what kind of associations are there between the different neighborhood features, and how does this impact the perceptions of residents who report feeling lonely and or socially isolated. Next, please. So this is basically just a very brief overview of what I would be doing over the course of 2 years. So there will be focus group discussions, as I introduced before, talking about or using personal and professional contacts in the 2 cities. Then there will be, this will also inform if we might need to adapt the Interact survey, at least for sure, a little bit for the Basel context to make it more locally specific. We'll also, or I was planning on doing 3 recruitment tracks for the e-survey. So one in Basel, doing an open call basically on various social media channels, writing news articles and try and get it featured in the local newspaper, because many people read that. with schools might also be quite interesting, especially what Pamela was talking about, that loneliness in school children or adolescents is quite high. So yeah, trying to go through different recruitment tracks just to catch as many as we can in Basel and Manchester. Then there will be interviews, sort of planning on 30 to 40 interviews, 15 to 20 people per city, sort of to get a solid basis, and then exploring the associations. So the expected outcomes, I think that is on the local level, we will see spatial variation in reported loneliness. This is for sure true on the country level. If we look at loneliness, even in Europe, there seems to be a loneliness gradient from north to south and west to east. So why it's probable that we'll also experience this on the neighborhood level. And then as a geographer, we always think, well, why do we see these patterns? So certain neighborhood features might help us in answering these questions. So I'm just planning on a couple of papers sort of on the scientific level, but I'd also really like to produce a lay summary of findings with infographics. I know Imperial is sort of upping their game on the infographics world. That would be really nice. And to also share with the participants, distributing them on the same social media channels as the survey was distributed, so that people really see what became of their results. I think that's a really nice way to engage them. And of course, blog posts and media articles would also be very nice.
Thank you, Nina, for taking us through your vision for this. I hope you succeed in the competition, and we will be delighted to collaborate with you and to have this consortium do great work and support the movement that is already happening. I really want to leave the concluding remarks to you and Pamela. Here's a summary slide. I don't think we need to go through that. When loneliness is recognized as the theme for this year's Mental Health Awareness Week, we would want to measure it, to understand it, to work with it, destigmatize it. And we hope that our research would add some new knowledge that would be helpful to help us tackle this problem for now and in the future. Nina, do you want to have any closing remarks before we pass to Professor Pamela Qualter?
It's basically just if anyone is sort of interested in the topic, feel free to reach out. I think we're all very open to any sorts of collaboration because we're also all from different backgrounds. So it's been really interesting for me as well, and I hope to embark on a loneliness research journey. That's all from me, thanks.
I want to say what a wonderful piece of work so far, Austen, you know, in the sense of bringing this all together, offering this to a community, gathering that kind of data that they can then use in the kind of interventions that they will develop for their citizens. I think it's wonderful. I'm really excited to see what we get from an academic perspective, but also seeing how they will use that information. So yeah, I think what you're doing is you're moving us much further down that line that we need to go down. So DCMS are kind of sitting there waiting to hear what you find. So really well done and really exciting to see what we get.